Wonderful. Let's go ahead and get started. I think we have our entire panel here. So let's welcome our attendees and our registrants to the webinar. Welcome to our webinar. We are talking with the team at GW Center for Integrative Medicine today, and we also have Shanti from our ChARM EHR platform. So first, I'll introduce myself. I'll go through the introductions of our panel, and we'll go into some of the agenda and what we'll be discussing today. My name is Hala Al-Hafez. I come to you from Fullscript, an online dispensing solution for integrative practitioners, and with a GW Center for Integrative Medicine in DC, one of our oldest accounts on Fullscript and one of the earliest adopters of the ChARM and Fullscript integration. We have Dr. Kogan. How are you, Dr. Kogan?
Hi, everybody. Great being here.
And of course, Dr. Orsier joining us on the phone, also working with a GW Center for Integrative Medicine. Hi, Dr. Orsier.
Hi there. Nice to be here.
Thank you. With ChARM EHR, we have Shanti, the marketing person that I've been working with for many years now with this integration. How's it going, Shanti? How are things on ChARM?
They're so good. Thank you, Hala. We're trying to pull through this together. And it's going good for now.
Amazing. So today we'll be, of course, discussing the value of the ChARM Fullscript integration, but we wanted to bring firsthand usage experience with GW Center for Integrative Medicine. So Dr. Kogan and Dr. Orsier are using this integration day in and day out. We wanted to hear from them. If you have any technical questions, feel free to ask away in the chat section. We have our support team, and then of course we have questions that will be addressed by our panel towards the end of the webinar. After discussing the value of the integration, we'll also be incorporating or discussing how the GW Center for Integrative Medicine adapted to the new norms in the changing healthcare landscape, and little tidbits or tips and tricks that any of our members here, practitioners, clinic owners or such, can accommodate in their practice moving forward. Dr. Kogan, you are the medical director of GW Center for Integrative Medicine, and you're a leader in integrative geriatrics. Tell us a little bit more about your line of work and your practice.
So, I kind of split my time between the university, where I'm full-time faculty as an associate professor in geriatrics and palliative care, and also being a medical director of the center. So I've been working at the center around the same time that Dr. Orsier joined, so about 12 years or so, 13 years. And at the clinic at the Center for Integrative Medicine, I tend to see very complex patients of all ages, versus at university, I'm seeing almost exclusively geriatric population, which is defined over 65, but in reality, we probably see most of the patients are over 80, 85. They're quite frail and have multiple problems. So, my kind of passion in the last 20 years has been developing the processes for treating older adults with complex chronic illnesses, minimizing pharmacological interventions and teaching next generations of docs and clinicians on how to do this in a thoughtful way. Unfortunately, as you're all familiar probably with the fact that drugs are a third killer currently. Every year it kills about a full spectrum of over roughly actually about same amount of deaths per year as the COVID done so far. So it's anywhere between 200, 250,000 patients or people per year. And you can imagine that majority of those are in the population that I serve, meaning people over 65, just because they're more predisposed to have side effects. Of course, they take more medications, they have more medical problems. So, I think that it's quite urgent that we learn new and teach next generations the new ways of treating patients with much more safer approaches. And sort of over the decade or so, this term integrative geriatrics came up, and in 2017 we published the definitive textbook through Oxford University Press and through the Andrew Weil Library of Integrative Textbooks. Mm-hmm. So that's mostly what I do, but I do occasionally even see kids in our own practice. Mm-hmm. I sort of, in a funny way, became kind of I was literally dumped into the area of medical cannabis, not because I wanted it, but because patients were asking. And I actually realized that it's a profoundly effective method for my older adults. And through that, I've also learned all kind of other approaches, even in pediatrics. So I'm continuously learning that. That's very new, very exciting. And it fits very well with our general integrative practice. It's a botanical method. I don't use any synthetic cannabinoids. So that's just in short.
Gotcha. Thank you. Thank you very much. We'd love to drill into some of these comments and content as well. And of course, with Dr. Orsier, you see patients with all conditions at GW Center, and you guide them through various treatment modalities, including, of course, nutrition, lifestyle changes, Western and Chinese medicine, acupuncture. So tell us a little bit more about your experience working at GW Center and what makes the center unique.
Sure. So I've been at the GW Center for Integrative Medicine since 2007. And I have a general naturopathic practice, which means that I see all different kinds of patients. And often it's people there's a few different types of people that come in, either people who have tried a lot of other sources for help and they haven't gotten the help that they're looking for, and so they're coming to us sort of as a last ditch, like, well, maybe these integrative complementary people can help, and then there's another group of people who are very this is what they believe from the get-go, and they're just looking for some place that can put together a holistic picture of their healthcare and what they need. And so we serve all those different kinds of people. Over the years, I have developed a specialty in integrative oncology, which is a new and emerging field of using complementary therapies to support patients who have a cancer diagnosis.
Yeah.
And the way that we do it at the center and the way that I work is definitely a complementary approach. It's not an alternative approach. So I have good relationships with many of the cancer centers around the DC area, and really supporting patients so that they can get everything out there that maybe the oncologists don't learn in their training, but that's available to support these patients as they go through this difficult time. So I work at the GW Breast Center, working with post-surgical breast cancer patients. And then the other thing that I do is I'm a teacher at Georgetown. I'm an adjunct faculty there in their Master's in Complementary and Integrative Medicine program. And so I teach nutrition, supplements, and botanicals there to master's level students most of them are going on into the healthcare field. And so what I love about my practice and our practice at GW, at the Center for Integrative Medicine, number one, what I love is the camaraderie and the collegiality between all of us, Dr. Kogan and Dr. Lednack and all of our other practitioners there. We have weekly staff meetings, and I know I can always turn to my colleagues there to ask questions or go do a case study together or review a research paper that we can all bring our different heads together on these things. The other thing I love is the depth of focus that we put on patients. So most patients who come to see us are amazed. They're like, I've never experienced this before, where somebody actually listens to me, actually takes my history, looks at all these different things, and tries to synthesize it together into a comprehensive approach. And that's really what we do. We're not just piecemeal. We're not just like looking at their lungs and giving them something for their lungs, or looking at their skin and giving them something for their skin. We're trying to treat the whole person.
That's amazing. That's very heartfelt, and I would love to understand a little bit more how your treatment and how your team works, all now delving into the tools and softwares that you use that allow for this communication, this functionality. And this is why it would be a great segue for actually Shanti to tell us a little bit more about ChARM EHR, which is one of the main tools that GW Center for Integrative Medicine uses as their EHR. For those unfamiliar or maybe looking around for other EHR platforms, Shanti, what what is special about ChARM EHR that I'm sure Dr. Kogan and Dr. Orsier will attest to as well.
Right. For those of you who are not familiar with ChARM, ChARM is MU certified cloud-based comprehensive EMR. And what that means is that it comes with a practice management module, a billing and RCM solution. It comes with patient engagement modules, and with several apps and add-ons that are all designed to make the practitioner's life better and easier. So ChARM is unique in that it comes with all these bells and whistles that you find in the bigger EMRs, but its pricing plan is extremely unique, and it allows you to expand as you grow, so to budget as you grow. That is, you spend more as you want to. We don't charge you huge sums of money up in front, so that's good for the practice. And also, it's listed as one of the best softwares. It's a front runner on software advice, and it is the fastest growing EMR with Fullscripts. And we use all the integration features that Fullscripts offers, which makes it extremely easy for the practitioner to prescribe while they're on the call with the patients.
Yeah, thank you so much. That's exactly it. And I think today we'll get into the nitty-gritty of this integration with our doctors. And then just a little intro for our attendees. The Fullscript and ChARM integration has been around for around 3 years. It is a tool that has been created exactly to make the practitioners' lives easier, and in a way, the patients' lives. Prior to this, and I think our doctors in our panel will agree, having an online dispensary through Fullscript or otherwise is a great solution for your patients to be able to dispense supplements online and not have to carry as much in-house. But having to dispense supplements online means having to write a recommendation that your patient then ends up ordering, and then having a separate EHR platform and having to duplicate this information is a tedious, inefficient, and probably requires a lot of administrative work. And this is what the integration was, the main goal of it was meant to take away that administrative work, take away some of the duplication of work of dispensing and then also managing your EHR. And I want to open this up now to Dr. Kogan and Dr. Orsier. Do you find that this is what the integration does for you? Can you tell us more about some of the values that you've specifically seen of this integration in your regular day-to-day?
Dee, do you want me to go first, or?
You can go ahead.
Okay. So, I mean, I think we actually, when we were looking for to switch to a new AMR, we had Practice Fusion before, and when they went into charging per provider, we have a lot of providers, and they were not willing to work with us on sort of some kind of package. So ChARM was one of the high considerations, and I remember even early on we asked about this integration because, you know, for us, since we have a very complex system, it's critical that we can optimize a lot of things so that our admin support does not have to keep track of where things are. And, you know, previously, in years ago, when we would have each practitioner have their own account set up with each dispensaries, it was just too complicated and there were too many things to handle. So once everything in one place, I think our administrative tasks got dramatically simplified. Early on, the integration suffered some glitches, which got fixed by now. Like, for example, now we can give a discount codes quite easily straight in there. We can give you know, we can check to make sure that the given product is not on back order, that it's in stock. That was a big concern because, you know, especially when you had early COVID, everything wasn't out of stock. So it was really difficult to trace. So, you know, that was definitely the biggest improvement, and it's been saving a lot of time. I think that's probably what our listeners would like to hear, because if you have to log into the two systems, and then if something is not right, you have to have your your admin person log into two different systems. It's just a lot of extra time back and forth. And more importantly, you know, since I'm a big proponent of trying to have a very standardized methods of practice, hoping that one day all of this will be somehow covered by insurances, or I don't know. I'm an idealist. I didn't grow up in this country. I have ideals that probably stupid and wrong, but whatever. And so I do hope that eventually one day some of the supplements can be more covered, or there are going to be some pathways. And so, it's critical to show that it's all part of the standard practice, that we're integrating the supplements just like medications, just like you would send the order for your whatever the prescription medication straight to the pharmacy, the same way it will get sent through straight to supplement pharmacy, or if you want to call it, and that it's coordinated clearly and in a compliance also with HIPAA and all other standards of practice.
Amazing. Dr. Osier, do you have anything to add to that as well?
Yeah, I agree with everything that Dr. Kogan said, and I also would just want to add that, well, first of all, I love ChARM, and I find it so easy to use, and their customer service is fantastic. And having the Fullscript integration, the one thing that Dr. Kogan didn't mention is that we can also access our templates and our favorites from the integration, which is key, for saving time. And we can also access the product descriptions. So all of that from within ChARM is pretty remarkable and very time-saving and helpful.
Wonderful. That's amazing. Yes, it's definitely through feedback from practitioners such as yourselves that the teams at ChARM and Fullscript were able to upgrade the integration with discounts and with categories and templates. And I'll just point that out to our attendees that this is always changing, always growing. I think ChARM attests to that as well. We always want to hear the provider feedback on usability and upgrade from there. Tell me a little bit more about your patient's reaction to, I guess, fulfilling their supplements online through Fullscript. Do you find that they, adhere to their supplement recommendations? I know that you always recommend supplements when needed, which is obviously the best way to practice. How has your patient's experience been with Fullscript?
I'll go first this time, Mish. So my patients love it. They love Fullscript. They constantly tell me, "Oh my gosh, it's so easy. It's so fast." And I even have this one patient who has a very difficult time keeping track of how many pills to take at what time and how many bottles he's going to need to order. And he actually has a Fullscript rep that helps him sit down and figure all that out. And he can't say enough good things about that. So the patients love it. And what also is very convenient with the integration with ChARM is just that then they can also see it from within the portal when they log into the portal, and they can, they see it in Fullscript, but they also can see it from the ChARM portal, which is helpful for them. And I know they love that.
Mm-hmm. Amazing. Dr. Kogan, anything to add?
Yeah, I actually think that there are a couple of components. So in the past, since I do a lot of Medicare, Medicaid, but it's half of my practice is Medicare, Medicaid, and so quite often, even with Medicaid, in certain situations, some of my patients can get some money back, not through the insurance, but through other means. Government, some of the patients living in the subsidized facilities actually can get some money back if they give copies of the supplements given as a prescription. So before the Fullscript was not recognized as a pharmacy, but if it's in my record and the patient just prints the recommendation, it all comes out in there right next to the medications, and then there's no questions from that perspective. So that's what I mean when I love to see that everything is integrated into the EMR. So there's really no kind of ifs or buts about it. It's pretty clear what this is. And so I find that some of the patients who were able to really kind of leverage this as a medical, and the same goes for tax purposes and for other purposes. And I know you guys even have capacity to take the Flex cards, HSA cards directly. So that kind of cuts out a need for us to write additional letters of medical necessity. It decreases patients' expenses, it decreases everybody's time. So it's another level of efficiency.
Wonderful. Yeah, that's exactly. I wanted to take that home with our attendees today that Fullscript does take FSA and HSA cards in the US, and that it's a free service for the provider to sign up and try with their patients. So there's really not much of a commitment. And then if you do then integrate it with your ChARM EHR, then it adds a lot of more levels of benefits, as the doctors were saying. Now let's delve into some of the specific workflows with a GW Center for Integrative Medicine. The machine itself, how do you find it flow? I guess even before COVID, how did the entire machine flow with your front desk staff utilizing softwares? And then specifically, how did you accommodate the change that happened earlier this year?
Dee, I'll start first. So I think it's
Okay.
been a huge shift, especially since once we shifted to the distant work pretty much instantly within just a few days when DC got closed down. And I would specifically applaud ChARM here, because I think with not just messaging within the system, that you're able to send a message to a patient, CC it to a provider, but we also have a system where there's an instant messaging. So it pops up on the screen, and instead of me calling front desk, and if I'm like right now I'm at home and I just finished seeing patient, and we actually had a technical problem getting my last patient on the Zoom. So instead of calling, texting, it's all within the same. So I'm sitting there checking the labs, and I'm also messaging Monica saying, look, where is she? We're supposed to start. Where is she? So Monica's like, oops, she forgot to download the software. So, so it's dramatically optimized. And so the supplements fall in there in the same way. So again, if I put the order, for example, earlier in the morning, we have a quite older woman who's really needs help in every step of the way. So I put the order, I would send a message to Monica and say, hey, can you help her to get this order processed, because she's not going to be able to figure out. So we order it for her on our end using her credit card, and then the order gets drop shipped directly to her house. And then also, if the patient also we then can also give the patient's instructions on how to take it, even if somehow she can't get into the Fullscript, because it's also in the ChARM. So in the portal, she'll be able to have an access. It becomes more complicated when patients are refusing to get the access to the portal, which occurs occasionally. So then we try to do other ways. We try not to email. It's not HIPAA regulated, but at least we can print the plan with the recommendations and then mail to a patient's house, or if they have fax it over.
Dr. O, what do you think in terms of this workflow and having an internal communication system? Any other recommendations or things that stood out with your workflow pre and post lockdowns?
Well, I think we were fortunate in that we had already established a lot of these systems in our practice, but I can't say enough about the ChARM messaging and the chat. Both of those we use heavily. The chat is within practitioners, so I can chat other practitioners, I chat the front desk, I chat our executive director, and the messaging I use back and forth with patients, and we can CC multiple, so I can CC our lab director and have her on the thread with the patient. It's just so good for all of our systems. And then I often will save messages in folders, like if we have an important clinical discussion on our messaging, I'll save that thread and put it into a folder to reference later. So it's really very helpful. And during COVID, it was tough for everyone. And I think quickly we were able to offer our patients a lot of support because we had all this in place, and that felt really good to be able to do that within short order,
Shanti,
Yeah.
is this internal communication tool of ChARM a new feature that you launched this year, or has it always been the
It
case?
has always been there. What we did launch this year is ChARM Connect. That also allows you to talk to the patients in the same way. Do you guys use that, Dr. Kogan?
I don't think so. I actually had a patient today tell me about it from another practice. So Deidre, I don't think we're using this. We got
No,
one.
I didn't even know about that.
Yeah, that's
We don't
awesome.
use Zoom, but we use another HIPAA compliant system. So what is the ChARM system?
So for Zoom, so for telehealth, we have Zoom inbuilt into ChARM, so you never have to leave the ChARM window. You can create your telehealth appointment, and the patient will see it in their patient portal, and they can just join the call from there. For chat, we have something called ChARM Connect, which is essentially the same thing you do within your practice. You can also do it with your patients.
Yeah, I think that we will definitely talk about.
Sorry.
Yeah. Why would you want to chat your patients though?
It's just easier back and forth than just doing messages. If you would like to do that, that is like you can send messages to your practice as well, but you prefer chat sometimes because you can do it from your phone. You don't have to open up the whole EHR app. So it's like if you're on your way to the office, you're not at your desk, it gets easier for you to take messages.
You know, I think some patients prefer that. They like the messaging because it's an instant communication. Again, this was today, this older woman, she actually communicates that way rather than going through the portal. I guess it's an extra step. I'm not sure. Are those messages,
it makes it much.
Can they read them on the phone?
Yes.
Oh, that's probably why. She's probably using it on her phone. Yeah.
Can you make phone calls with the ChARM Connect, or is it just video and chat?
It's chat. So the video is different. The video is telehealth. The ChARM Connect is just for chat.
Yeah, we don't have the video integrated with ChARM because we have a free included package with our phone company. So we actually signed up for the Ring Central, which is Zoom, I think, bought them. Yes. It's basically identical platform. So we've signed up with them years ago. We just realized we should have capacity to do a telemedicine with integrated provider with a system that same as our phone lines. So we actually have an app that allows us to communicate in between each other, having our staff meeting through the same platform, and it's all kind of put together in the same fee structure as a regular phone line. So in fact, our phone line is the Ring Central. So it kind of didn't make sense for us to now also do it through the ChARM, although maybe those two systems eventually can also get integrated. Everything in one place. I don't know. We haven't talked to them yet. Yeah, but
we will try.
Yeah. So what I'm hearing is, of course, with COVID or otherwise, I think the need for an internal communication tool is essential to the team, to the success of the business in the clinic. And of course, having some sort of telehealth solution, whether through your EHR or otherwise a HIPAA compliant telehealth solution to be able to accommodate virtual appointments, and then taking your notes in your EHRs. Any other tips that you find that you think would be also useful to providers, still trying to figure that out?
Tips about ChARM or tips about the integration or both or either?
General workflow, especially accommodating more virtual, virtual visits, and maybe talk more about that patient practitioner connection. How have you been able to have that more virtually, and maybe in the comfort of your homes?
do you want to try to respond? I'm browsing the questions.
Well, sure. I mean, the first thing that comes to mind when you ask that question, of course, is it's the fundamental doctor-patient relationship. So it really has very little to do with the technology, and it has everything to do with being present when you connect with your patient, even if you've had technical difficulties getting connected, but being present and open and checking in with them to see how they are and get everything settled before you dive into their medical history or whatever it is that you're doing. One thing that we do also is at the beginning of every new patient visit, of course, we have a disclosure statement that we basically read to the patient. It's just a few sentences, but we make sure they understand the risks of telemedicine, and then we also ask for a callback number so that if we get disconnected, we know the best way to get back to them, and we talk about, security and so forth. But honestly, I feel like, and it's probably less so now, but in the beginning of this pandemic, I was every day I was talking to patients who hadn't spoken to anyone, and they hadn't had a connection with anyone in a long time because we were all so isolated. And so my role at that time actually felt even more profound in the sense that I'm not a therapist, and I never claimed to be a therapist, but I was a first contact for people to really talk about how this is for them and what's going on, with this situation that we all find ourselves in. And to have the technology, it's been critical. I mean, everyone knows that. That's not new news to anyone. And even all of us in our practice, it was very important for us to have this because during the beginning of the pandemic, we had staff meetings 2, sometimes 3 times a week. And fortunately, we had Dr. Kogan who had really frontline updates about what was going on with the pandemic in the city. And so being able to connect that way was critical.
Right. I think you were mentioning you've increased your internal staff meetings after, just because you needed all to be connected and receiving the same information. And maybe that's a tip for practitioners. Definitely increase your communication with your team and maybe increase the staff meeting, add another one during the week, right? Absolutely.
There are so many great questions. I was looking at the questions. There's some great questions. So,
yeah,
no, I don't think I have much to add to this.
I do want to dive or take it into more so the integration and specifically the tips on utilizing the integrations, the integration in ChARM. I know Dr. Orsier, you mentioned build categories and templates because that's a time saver. Dr. Kogan, I think one thing you mentioned, and maybe delve a little bit deeper into that, searching for products in your ChARM EHR, searching for Fullscript items in your ChARM EHR, and how you usually use the brand filter. If you can just elaborate there for some attendees that do use this integration.
Yeah, I mean, I think that's a better question for naturopath, for Deidre, partially because my repertoire of the supplements is much smaller. So it's a little easier for me. I pick things remembering the names. There's a really good feature of centering around the specific brand. So, if you just put resveratrol or whatever, you're going to have a lot of products come up. But if you know the brand, you can narrow it very quickly. It's actually a whole lot easier than figuring out which medication you have to order. If I were to critique ChARM, I only critique it around this area, because the way they design the medication order, you have to put the name of the drug and the dosing. You can't put the dosing, but it's not precise. So let's say I'm ordering, a medication that can have 40 different doses or 30 or whatever. It's going to pull all of them, all the generics and all the trade names, and there's going to be 100 some drugs on the list, and you have to figure out which one you want to pick. Scroll down takes a lot longer. With supplements, my way of getting to what I need is way faster than medications usually. So I don't know how many seconds, but it's pretty quick. You got the Emerson integration. I'm sure you guys are going to work on because it needs a little bit of help. But that's actually, I think, one of the great features of a ChARM. They tend to improve flow very quickly after we would complain. Complaining is also very easy, and that gets solved pretty short time frame. So I think that capacity saves time. It's gotten now to a point where if you like Fullscript and you go straight to your website, to your guys' Fullscript website, the time of finding stuff on a ChARM versus Fullscript is virtually identical, at least for me. I mean, maybe if I'm looking for something unusual, it could be different, but that doesn't happen all that frequent. I'm talking about the regular flow of work. I don't use a lot of templates, but part of it is because, I don't know, I was always trained on not having pre-filled boxes, but you know, Deirdre, you're probably better off talking about templates. I know you like some of them. But that's a feature in both systems. So sometimes I use it. I have few, but very few. Mostly I just sort of, you know, pick what I want one by one.
Right. Dr. Orsier, if you wanted to add even some of the feedback you were giving me that sometimes you wanted to browse through the integration, I wanted to introduce one of the updates. So if you want to even discuss some of the feedback you had around searching within ChARM for nutraceuticals through Fullscript.
Yeah. So I use both favorites and I use templates, both of those, and they are each good in different ways.
Right.
Sometimes I will put together, you know, I'll do a lot of research into a particular condition or situation, and then I'll make a plan, and it's something that I probably will want to reuse repeatedly. You know, for example, I have a Hashimoto's protocol or something like that, and I figured out which products I like and which dosing I like. And so I will create a template off of that initial prescription in Fullscript. The favorites are a way that I can just dump a bunch of stuff into essentially a folder and then look later for it. So from within ChARM, sometimes I can use ChARM and in the ChARM Fullscript integration to search for something new. Like, let's say I want to figure out, you know, what's new out there for adrenal adaptogenic supplements. And sometimes I can do that from within the integration, but more often than not, I usually head over either to the Fullscript website or, well, usually I'll go to the Fullscript website and then I will search adaptogens. Or if I know I wanted to have, you know, ashwagandha, I'll put that in and then I'll see what comes up. So the thing about both of these search functions in both systems, which I know it's so difficult, and I did mention when we talked before, is just that it's difficult to search complex parameters. You have to really search by an exact word, and if it's something that goes by 3 or 4 different words, like let's say CoQ10, ubiquinol, ubiquinone, you know, it's going to be hard to get all of those things under one search. So you have to do repeated searches.
Yeah, absolutely. I remember hearing that a couple of weeks ago when we talked and discussed this, and I just wanted to highlight that one of the main things we're doing at Fullscript is actually upgrading the search always. And that's something that we have incorporated and are still working on, this concept of you don't need to know the name of the product. You are looking for, say, an ingredient or a class of ingredients. It is now accommodated in the Fullscript search experience where you can search, let's say, an ingredient, let's say vitamin B, and it actually pulls up all the products that have that ingredient at a specific the quantity if you want to customize that as well, regardless of the product name. So if the vitamin B is called Amazing B, it will still show up in the results because it has that as an ingredient. And it's actually something I spoke very recently to the ChARM development team about. I think we want to be able to incorporate that into your ChARM EHR, even though you're probably using the EHR to recommend items to the patients and you're like in the patient chart, but having this ability to openly browse and maybe use ChARM to then favorite something and know that you'll come to it later. That's where we're going with the integration, and that's what we want to improve and upgrade with the ChARM Fullscript integration, is that search browsing functionality.
And one other thing while you're on the topic of that,
yeah.
The other thing is adding in a brand search along with that. So you can combine, you can say, only show me these 6 brands or something like that. Not just one brand, because right now you can do one brand, but you can't do multiple brands, which would be ideal for me.
Yeah, I love that feedback. It's great feedback to receive as I'm speaking to our team. Right now, if you go to the Fullscript website, you are able to select a search and just use 3 brands, 6 brands, whatever it is, and get the results there.
Oh, you are?
Yeah, it's there. It's this brand new search. And you know, this is interesting. Is this search has been upgraded? Yeah, it's upgraded on Fullscript, but you guys live in ChARM, and actually something that you were telling me earlier is you barely log into the Fullscript platform because you live in your EHR, which is exactly the point of this integration. It's for you to not log into the Fullscript platform and log in and continue using it through your EHR, because that's your workflow. So the idea here is our teams, Shanti's team and myself, want to use the new updated search to incorporate it into the ChARM integration. But it is there if you're openly browsing. It's just another tab. And sometimes I say just another tab, and I know our providers are like, we have so many tabs open. So just another tab is a huge ask. But yeah, it's if you open a new tab, go to Fullscript and search, you can definitely search multiple brands for us.
I think ChARM is working on making some improvements to the Fullscript integration. So our ultimate goal is to make it completely seamless, so you don't have to log into Fullscript at all and just keep using all the features through ChARM.
Yeah, that's absolutely the case. That's really our end goal here. So I'm glad that I heard that feedback, and our listeners heard that over as well. You know, we are coming towards the last 10 minutes of our webinar. So I just wanted to open the floor, Dr. Kogan, Dr. Orsier, to any further tips, tricks, suggestions, solutions that you can provide to our listeners as we also look through for questions.
Yeah, I think we should do questions. I think people are probably burning. I've tried to answer certain questions that I could by typing to everybody or individuals, but you know, I would say just go for integration, because you will end up saving so much time at the end of it that it's so much worth admin. You know, it's money saving for you. Otherwise, you have to have more admin support or spend more time yourself doing these things in parallel from different systems.
Wonderful. Dr. Orsier, anything else?
Well, someone had asked about prescriptions, like pharmacy prescriptions, and I just wanted to mention that, you know, ChARM has a full list of all drugs. So electronic prescribing through ChARM is extremely easy.
Yeah,
you don't have to enter it. You don't have to enter it yourself.
Right, you can do ERX and EPCS through ChARM. It's a separate integration than for supplements. And we have a bunch of pharmacies listed already. You can integrate with them and have the patient just go there and pick up your prescription when you put that into the system.
Moreover, those of you here who need controlled substance, you guys would like to know that it's a pretty low annual cost and it works really well. You don't need to write scripts, everything's electronic. In fact, Santi, close your ears, and you're probably right, but you probably know that. I had a situation where university, you know, that's a million visits per year, right? They have the outdated system that they only this year gotten to do the electronic controlled substance prescriptions. Before that, for all my division, once a week for different practitioners, they would call me in panic saying, oh my God, I have a patient who needs an OPID prescription overnight. Please, please do help me. So I would go into ChARM, put the patient in there, and totally, by the way, bad news for me. I could have gotten in a lot of trouble, but it's my own faculty. So, and it works. I mean, it's one of the, again, some of those features, they seem like they're minor things, but when you collectively put them together, you end up saving so much time and effort that otherwise, like in the past with controlled substances, you had to physically write prescription. You had to mail it to the patient or have them come pick it up. It was a mess. We had to keep a log of each script, scan it into the EMR to make sure that, and double cross, make sure that this was the patient in a month doesn't get second prescription earlier than supposed to. Now it's all electronic. There's no glitches. It works perfect.
And it's extremely secure, so you don't have to worry about that too.
Yeah, you just need your phone, or you have a special little like a unit for the second ID. I use my phone.
That's amazing. I am looking through these questions. Go ahead, Dr. Orsier.
Well, yeah, I have one question for Fullscript, actually, that you can hopefully answer, which is on the list of questions, and I've had it before, too. So does Fullscript have a way to track quality? Because, there are certain other systems that, gold, silver, platinum, that kind of thing, and other supplement dispensary systems. And so has Fullscript tried to do anything like that, where you actually rate brands based on their quality control and how well they monitor their own ingredients?
So what we've incorporated is a filter for so-called third-party certification. So we don't personally certify the brand or vet anything. We want to be as brand agnostic and provide the providers with as much information as they need. But what we did incorporate into the new search is something called the third-party certifications, such as CGMP, of course, certified vegan, certified this or that, informed choice, informed sport, non-GMO verified, a USP. So we have a bunch of certifications, and what we've done basically is went through our products that we have, and we're able to tag those that from the manufacturers showed that they are certified, for example, CGMP. So they provided us with that information, and now that information is organized and tagged so that you are able to then search for items that are of a specific certification that you care for, or even an allergen. You want something that's gluten-free, dairy-free, so on and so forth. We have that. We've incorporated that to be able to give you some more granularity to specific filters, not necessarily ingredients, but rather things that you need to know for the patient, right? As well as form. It needs to be a chewable. It needs to be a liquid. So these are now tagged into the product itself. So if you want to look up all vitamin, so on, that's a liquid, you're able to do that.
So I think what that's bringing up is how our profession is still, we don't have, I know that there have been proposed quality control ratings, but we don't have good ones, really. The ones that are available are not, I know the question that this person is asking, and it's on a different level.
Yeah.
So we're responsible as practitioners. We're responsible for knowing our products is what it comes down to.
Yeah, I think so. And I think this is where, and you mentioned it, you trust certain brands because I think you've done the research behind it, and certain brands have the quality and have given the results to your patients that you found useful. And so if the case is to trust these brands, then by all means do. And hopefully we do have some sort of better standardization that we would be very open to receiving on the Fullscript platform. The idea is to try to impact the industry, especially the supplement industry that's not very much regulated, and we are at the forefront of trying to make that happen. I'm getting a question here. Yeah, I think that's the question, Dr. Orsier, that you were reading to me as well. I have someone, Dr. Day, mentioning here, in the integration, is it set up to the saved instructions on each supplement? Last I looked, the templates come through with specific saved instructions, and others don't. I'll take that because that is coming in the upgrades. But I wanted to clarify that we have supplier suggested dosing instructions. So that's what the supplier recommends as the dosing for the supplement, built into the integration and can be pulled into ChARM. Dr. Orsier, do you find that you tend to change those dosing instructions often and based on
I'm
patient
shaking
needs?
my head. You can't see me. Yeah, I always change it. I never use the supplier dosage, ever. I mean, occasionally it happens by coincidence, but I always am changing it. Yeah. And that's one of the really important things to let patients know is like, you cannot go by what the bottle says. You have to go by what your doctor says.
Yeah, we make it clear to all of our patients. I think nobody should ever use pre-filled templates, period, because of this, because otherwise you'll get in a habit of forgetting to check. And I never, ever use that. I always individually change just like what Dr. says, always. I don't even care what comes up because, and even if I do a repeated refill, if patient asks me to resend new order, I still go back and I check each time, because otherwise slippery slope. Forget you.
Yeah, I use pre-filled dosing for sure on the Fullscript website when I do, when I bring up my supplements, and I love that feature, but I always am changing things around and updating and double checking for sure. So like, fish oil capsules, 2 twice a day. I do it with like 90% of the people.
But you can keep that in your templates, right? Is that?
Say that again?
In the ChARM templates, you can put in your dosage that you want to come up by default when you're prescribing. Is that right?
I'm not remembering right now with the ChARM templates, if I pull down a ChARM template, if it has my dosing, or if I thought that the ChARM templates just pull down the supplements and then I have to enter the dosing myself, but I could be wrong about that.
I think you can enter it, and then you can also change it when you're actually prescribing.
Okay.
But it's so quickly, it takes a second to put the dosing. I rather spend that second paying attention to exact dosing and not forget to do it, than, because I'm much more structured that way. I'm much more likely, if I just click the template all filled in, it would be a lot more likely for me to miss updating. And then you're going to end up with way more trouble down the road, because the patient's going to contact you saying, wait a second, you said that, but it's written this. What do I do? And it's enough that patients get confused with the labels on the bottles, because everybody's saying, wait a second, suggested use. But we've trained our patients to ignore those, basically. They know that we always put instructions into the notes. And so they're in 2 places. So if they can't go back to Fullscript because they don't want to, they can also go into ChARM, and then it's the same exact dosing in both places.
That's
it's kind of the same with the. I was just going to say, it's kind of the same with this contraindications question. Like, I used to think like, oh, wouldn't it be great if I could have my contraindications just pop up and have, but the way that they're laid out in all the, like natural medicine database and everything, they're like almost useless, because there's like so many over contraindications. And basically as a practitioner, you just really have to know what you're doing. You have to understand what the contraindication might be and whether it applies to this very patient, because a lot of times it doesn't.
But I will say that for the meds, Santi, that has nothing to do with Hollis and Fullscript, but for the meds, you guys should have the automatic interaction check. A lot of newer EMRs, even the older ones, have that. So in GW, they have a Citrix, it's a TouchWorks, it's a really old and terrible system. Hopefully nobody's hearing me from GW and get fired. But you know, they have an automatic check. So when you try to put the two meds that have built-in interactions, it'll flag it. Now you can skip the flag, but it helps you to automatically, because we can't forget that. I'm not as concerned with supplements because there's so few things and we tend to know them by heart. But meds to meds, it's sometimes a problem. So.
I think that's already there. I'll check and get back to you.
I have not seen it. I have not seen this happen a lot. So maybe it's just because we don't really.
I think we do have food-drug interactions and drug-drug interactions and those built
Yeah,
in.
well, we don't put, Deidre, I don't put like a chemo and other heavy drugs that we don't prescribe in EMR. Maybe that's why we don't see this. Maybe it's already in there, but I would, if not, it should be automatic.
Right. I'll look into that and let you know about it.
We got a quick question of ChARM being HIPAA compliant. I think it's just valuable to address that live, that it absolutely is. Shanti
Yes.
and doctors, if you want to just comment on that, of course, that it is, and Fullscript as well.
Yes, ChARM is absolutely HIPAA compliant. Everything you do is secure. So yeah, all the patient information is protected on it.
One question, I think it would be great to have the doctors address, and the doctor mentioned it's okay to save until the end. We are wrapping up towards the end of our session. I'm planning to migrate to ChARM in the next month. Can you speak to the flow of entering both supplements and pharmaceuticals into the ChARM platform, and maybe just the general workflow of needing to do both? If you do both?
Yeah, I do that all the time, and it's just it's in the same vicinity, so to speak. It's when you're in a patient's plan, they're right next to each other. So like you do a meds first, for example, then you go to supplements, you click on that, and then you fill it out. And I think I already said that I actually like entering supplements. It's a little bit easier for me than meds. But it's pretty well organized. And in terms of flow, it's up to you what sequence you want to use. I follow the ChARM preset sequence, so it's just top, bottom, left, right. So, you know, prescriptions, lifestyle, handouts, follow-ups.
Imaging.
Like imaging, yeah. Right, and labs, you know, so labs are, I think, I can't quite remember right now which one goes first, prescriptions or labs. I think labs first, maybe. It doesn't matter. I mean, I just follow. It's kind of easy because you don't miss anything this way.
Wonderful. We are getting a question about the Fullscript search, which I think is coming up in the ChARM integration soon. So I'll go ahead and address that. It is about, can we get a way to put the name of the supplement, and it can tell us which one contains the amount of what we are looking for. For example, I want the highest form of X ingredient. So as I was saying, the new search upgrades do allow you to select the exact amount that you're looking for. It doesn't just give you the highest or the lowest, but if you're looking for 10 mg, select that, and it should then be able to pull in the results into the Fullscript platform, and again, very soon in the ChARM integration. So I would start there. And our practitioners are saying this tech stuff is crazy, but you know, figuring out technology, I think especially in this day and age, of course, has been a challenge for all of us, even the millennials. So don't you worry. If you have any comments on technology, or you know, how you've been able to accommodate that, please feel free to share.
Yeah, I'm with Steven Wasserman on this one. I hate this stuff, but you know, you have no choice. You kind of have to do it. Otherwise, you're gonna hate yourself more for not doing it. That's my excuse. I'm like, if I don't do it, then I'll dislike myself more for not doing it than for spending time and saying, okay, fine, gotta do it. So, you know, now I'm mastering social media. That's the next disaster.
Any tips on getting patients to utilize the ChARM patient portal? We're seeing about 5% of our patients utilizing that. And I know Dr. Orsier, you said that most of your patients are using the patient portal.
Yeah,
Do you have any tips there?
Virtually everyone uses it
Yeah.
in our practice. We have maybe, I mean, really like 1 or 2 patients who just refuse. But even though my one patient who refused, I eventually sat her down with her iPad, like in my office, and helped her get logged on. And once she figured it out, she knew how to do it, and now she does it all the time. But basically, when our front desk staff got trained in it and they figured out how to help people get in, that was where we turned the corner. Because I can't, as a practitioner, and I'm sure everyone on this call who's listening knows, like, you can't spend your time helping somebody get logged into a portal. I mean, that's insane. So once our front desk staff really put the time in to figure out how to use ChARM, what the problems were for people, and how to get in, then they could quickly help people and quickly get people in. I actually don't know whether ChARM offers this service for individual patients, whether people can call you and get help to get logged in with our portal. But at this point, it's pretty fluid, especially since the pandemic when everybody has to be online anyway. And people are, we didn't even talk about uploading records. I mean, we used to have, our front desk used to spend hours and hours uploading, scanning, faxing, and now patients do it. They do it themselves. They upload all their PDFs and everything. It's amazing.
Yeah,
So
I mean,
anyway,
it's very common for us to have a patient with 1,000, 5,000, 10,000 pages of records. I'm not kidding. We have people coming in after Cleveland Clinic, Mayo Clinic, after being in Paracelsus, everywhere, and they finally come to us, and they're like literally suitcases of records. In the past, we had to do it all manually. Now we just tell patients, you must do it yourself. You don't pay us for the admin time, so go ahead and do it. You know, it actually also interesting, it pushes patients to organize their records in a much more efficient way too, and then pass it on to us. We're trying to mandate it, and we just say, look, it's a HIPAA problem if you email us. It's even more HIPAA problem if you try to sort of mail it. I mean, that's total lack of control of somebody opening the mail and, you know, all over the place. And so, you know, there's a lot of things to be said to tell people you need to do it, but then help them to do it. And you know, I think we're right. I think Didra's right. I think we're 95% plus in terms of getting even. And look, and half of my practice in the clinic is people over 80. So what's your excuse? Basically.
Yeah. I think then maybe
absolutely want to say, I just want to add that we are coming up with something called the passport, which is basically all the information in your PHR the patient can print and keep it on their person. So especially during pandemics and situations like this, with demographics that cannot advocate for themselves, it's a blessing, it's a lifesaver to have all of your information in one place that practitioners can just see. So I would absolutely recommend it. And yes, ChARM does talk to patients who need help getting on the portal, but we would prefer the practice or the front desk doesn't. It's on them. The patient portal is absolutely free, so I would recommend everybody get on it, and it's invaluable really especially for the older demographic. To not go out and search for folders and records and just be able to see everything in one place. It's a blessing. Yeah.
Absolutely. So I think one takeaway tip is really maybe empower your front desk staff to the importance of the patient portal, and then using them to help your patients sign up and utilize the patient portal. And yes, some patients, you know, are going to be a little bit more difficult, but it's a necessity, and maybe just putting the onus and the responsibility on the patient just helps them organize themselves and their lives a little bit better.
Yeah, as you said, it just takes to get them to sign up, and once they do, they're all set. So.
Yeah. I know we have a ton of other questions, but we are wrapping towards the end of our time here. What I would do is print out not print out. I'm going to save all these questions and go through them, maybe send you, Dr. Kogan, Dr. Orsier, some questions to address via email, and then we can wrap it all up and send it in the recording with this video and with a small kind of tips section towards the the end of the wrap up. So I think we could do it that way in case some of your questions were left unanswered. But I noticed that Dr. Kogan already went into the chat and chatted through some of these questions, and we have our support teams answering a lot of these questions as well. So with that, I wanted to bid you all farewell. Thank you so much for joining me today. Apologize for the technical difficulties at the beginning, and just open the floor if you have anything else that you wanted to say before you sign off.
Thanks,
Well, if you
Morgan.
guys have any questions about ChARM, you can visit our website, charmhealth.com, or email support@charmhealth.com.
Thanks, Shanti.
Well, I wish you guys could see me. I'm smiling, and it's been a pleasure to spend time talking about this. ChARM has made my life so much easier, and I'm very happy to, as you can tell, talk about how great it is. So, yeah, anyway, thank you.
Of course, Dr. Orsier, thank you for joining us. Have a good one.